This is a CJSN podcast, and I'm Dr. Rahul Chanchlani at McMaster Children's Hospital in Hamilton, Canada, and with me is Dr. Danielle Nash from ICES. It is a pleasure to discuss our paper titled Secular Trends in Incidence, Modality, and Mortality with Dialysis-Receiving Acute Kidney Injury Among Children in Ontario on behalf of our co-authors, which was recently published in the CJSN. The trends in the incidence of acute kidney injury over time have not been well documented in children. We conducted a population-based cohort study to assess changes in the incidence of dialysis receiving acute kidney injury among children over a period of 20 years using health administrative databases in Ontario, Canada.
We identified all neonates and children who received their first treatment with dialysis for acute kidney injury between 1996 and 2015. We did not count those who received dialysis for end-stage kidney disease, inborn errors of metabolism, or poisonings. From almost 2.4 million pediatric hospitalizations, we identified approximately 1,400 cases of children treated with dialysis for acute kidney injury. The median age at dialysis initiation among children consistently decreased over time and was 3 years in more recent study years compared to 13 years in the late 90s and early 2000s. There was a significant increase in the incidence of dialysis receiving acute kidney injury among hospitalized children from 0.6 per 1,000 person years in 1996 to 0.7 per 1,000 person years in 2015. The use of continuous kidney replacement therapy and intermittent hemodialysis increased while the relative use of peritoneal dialysis declined over time. The proportion of those who died within 30 days after initiating dialysis receiving acute kidney injury increased from 14% to 25% between 1996 and 2009, and then reduced to 19% in the more recent years.
So to summarize, the incidence of dialysis receiving acute kidney injury has increased significantly among neonates and children in Ontario between 1996 and 2015. The use of hemodialysis and continuous kidney replacement therapy have increased, with a decline in the use of peritoneal dialysis over the last 2 decades. Future research should aim to test strategies that will improve outcomes in this vulnerable population. We thank the editors of the CJSN for providing us the opportunity to share our work through this podcast.
This podcast is copyrighted by the American Society of Nephrology, all rights reserved. All content in this podcast is for informational purposes only and is not intended to be medical advice. This podcast should not be used in a medical emergency or for the diagnosis or treatment of any medical condition. Please consult your doctor or other qualified healthcare provider if you have any questions about any medical condition or before taking any drug, changing your diet, or commencing or discontinuing any course of treatment. Thank you for listening to this podcast of the American Society of Nephrology.